Hello there. My name's Kate Williams. Welcome to this session where I'm going to be talking about the Masters in Applied Health Research, or the MRes, here at Leicester. My name's Professor Kate Williams. I'm a Professor of Education in Applied Health Research. So I have a background in research, but have also done a lot of teaching, probably over the last 10 years. I'm co-director of the course with my colleague, Dr. Samuel Kai, who can't be here today because he's on leave. So Samuel is an active researcher. He does a lot of work around environmental health. And certainly the research that I've done is very much in applied health research. So what I'm going to do is I'm just going to present a few slides. It'll probably take about 15 minutes or so. I hope that I'm going to be able to cover more things than you could read on our website, but just to give you a taste really of what our programme's all about. So I hope to, in this session, talk about three things, what you're going to learn in this session. So I suppose the first icon is really about the place. It's about Leicester, but it's also about the department and school from which we work. So you'll learn a bit more about that. The central icon is really about how we teach and how important that is to us and the type of teaching that we do. And then the third icon is really about the community that you would be a part of if you joined us here for the MRes in Applied Health Research. So they're the three things that I'm sort of going to constantly touch on as I go through this presentation. Before I start though, I suppose I'm sort of starting at the end point. So where could an MRes in applied health research take you? So what I've got is just in a couple of slides here are two examples of what people did after they completed the MRes. So obviously, we feel that our MRes offers you a real gateway to a range of research-based careers, but it also offers a really good foundation for doctoral research and ultimately an academic career. So I'm just going to read out a couple of these sort of testimonials or our former students and what they've said. So the first one is Mariam, and I was trying to think when Mariam was with us, and I don't think it was last year, it may have been the year before, but I'll just read it out to you. So it says, I'm Mariam and I'm a medical doctor from Italy. Thinking about a career in research, I applied for the MRes in Applied Health Research. During the year, I was able to discover and learn skills necessary for a good researcher. I was also encouraged to apply for a PhD programme, and this was something that I really appreciated. Fundamentals of Applied Health Research was my favourite module, as it gave me the opportunity to think about my own research project and to create one from the beginning. After graduation, I hope to start a PhD in infection immunity and inflammation at the University of Leicester. So this was Mariam's sort of testimonial, and I can update you because she is doing a PhD here at Leicester. And I can also tell you that she liked the Fundamentals of Applied Health Research module, which I'm very pleased about because that is the module that I teach and lead on. So that's just a bit about Mariam. The next one came from Sian, who she was a couple of years actually before Mariam. And what she said about the course is the course was insightful and the staff were really supportive and approachable. The course has opened a lot of opportunities for me, and I would not be where I am in my career without the MRes. I'm now employed as a research nurse for a large 20-year cohort study. For those with an interest in research, I would definitely recommend it. So I think what I can tell you about these people who took the MRes, they were both actually people in health professional backgrounds, but I've had a student last year, I think it was last year, who actually came from a sociology background, so completely their first degree was in straight sociology, and they gave some really positive feedback about the course too, and so I don't think you don't have to be a healthcare professional to get a lot out of this programme. So I wanted to sort of start at the end in a way is what you can get out of it. But I'm going to talk a bit now about some of those things, about where are we based, those sorts of things, and what's the mission of the organisation in which you'd be placed. So this course is sort of situated within the Department of Population Health Sciences, which is very closely affiliated with Leicester Medical School. So obviously the Leicester Medical School is largely interested in supporting undergraduate medical students, and so population health sciences sort of kicks in more in terms of postgraduate courses and of course doctoral courses as well. So the mission of the population health sciences is really just to understand and improve population health, and it is really a department that leads on a huge amount of international quality research and teaching. And also there's quite a lot of focus on methodological development as well, particularly through medical statistics. So in terms of postgraduate teaching, there is this master's in applied health research, there's a master's in quality and safety. Medical statistics is a very long established master's degree, pretty much like ours in applied health research, data science and diabetes. Just to give you a bit of an idea about the community, there's a range of research groups within the department, and I would say we probably on average have around 50 PhD students, so quite a vibrant environment in which to work. So I just wanted to mention that to start with. Just a little bit more about the MRes itself. So the aim of the MRes is really about understanding lots of the approaches and methods used really to develop your research skills. It's all about developing your skills to undertake an original piece of research. And the structure is really clear. There are 4 taught modules, which might not sound like very many. They're each 15 credits. There are 3 core modules, and I'll talk a bit about each of those, and 1 option module. But very much the largest part of this MRes is a dissertation, which is 120 credits. So this is really quite a large research project. We try to keep some themes running through all of the work we do, particularly around critical appraisal, patient and public involvement, the idea of inclusion, you know, what are we working with here, and ethics. So these are just some themes that run through. I'm really happy to take questions, and we can talk a bit more about that. It's quite important to know that the research modules that we provide within this course are accessed by quite a lot of other courses. And so this is that sort of community again that I spoke about at the very beginning. So we would have students who are signed up to the MRes and applied health research, but we would also have on our course, on each of these modules, students who are intercalating. So this is medical students have the option to take a year to do a piece of research, and so to do a research degree effectively, and they're called intercalated medical students. And we usually have quite a big group of those students who come through our course. We draw people from other courses as well. They learn their research methods with us. So that would include people who are involved in research, who are doing master's degrees in, for example, cardiovascular sciences. So they would get some of their basic research method stuff from us, and the MRes, the masters in quality and safety. So I just want to give you an idea that whilst you would be part of a master's in applied health research, and I think it's quite positive, you'd have quite a lot of other students who were engaged in different activities. So you get quite a diversity of people engaged in each of the modules, which I think is probably a positive of the course. So I'm going to just run through, not in any great detail, but just a little bit about each of the modules. So this is the module I spoke about that Samuel and I lead. I've led this module probably for about the last 6 years. And Samuel is actually coming on to lead it, so I will then co-lead it with him this coming year. So yeah, I suppose the aim of this module is really to understand how different scientific disciplines and methods can be used to structure inquiry and develop the evidence base in applied health research. Really, your learning objectives are around gaining skills in the essential art of appraising and synthesizing evidence. So it's quite fundamental. We also look at overarching, we look at the different research paradigms in applied health research. So I think I would say it's a layering approach. So in this particular module, we start to think about these things, and then they go into more depth in future modules. Some of the things we spend time on is talking around patient and public involvement, research governance, ethics and inclusion in applied health research. So all those really important components that underpin any exercise in applied health research. So one of the things that, and it was one of the things actually that Mariam wrote about when she talked about the course, one of our assignments is about formulating a research question and then writing a research proposal. And that's really quite, I suppose the whole module is about that, which is extremely difficult to do, to identify, formulate a research question, apply an appropriate methodology, and think about what sort of analysis you might use to address that problem. So it's quite a practically based module. So this is just a short description of the sort of things that we cover. So what we do is we use experts in the field. So we would, if people talking around patient and public involvement, these would be active researchers who do a lot of work in this area. I mean, our research ethics is taught by, an expert in the field, introduction to quantitative and qualitative methods. Again, we use active researchers. A lot of examples they use are, relevant, recently published papers. So it's really quite engaging work. So one of the things I was talking about at the beginning was, so how do we teach? And I'll say a little bit about for each of the modules, but, we do a lot of, everything is face-to-face. We do a lot of face-to-face interactive lecture content. We constantly use interactive exercises and group work. We get a lot of feedback on that. For this module, we do have one e-learning module, but most of it is face-to-face. We do sort of surgeries with the module lead. So that's an opportunity for everybody to come together to ask questions of the module lead. We use Blackboard, which is our interactive site for any questions, and of course really open to direct email contact with the module lead. So I think the sorts of things I'm talking about will be consistent across a lot of the modules. There are 2 assignments within this particular module. The first is a written assignment around this research proposal, and it is 85% of the assessment, but it is in 2 parts, because 15% of the assessment is actually an oral presentation of that piece of work, of your first part of the assignment. This is probably the bit I really enjoy. It's really great seeing people's work sort of come to life, and then responding to questions about the design of their project. So this particular assignment is not necessarily a project you'd ever do, but I think that's why people quite enjoy this assignment, because it's very much, just thinking outside the box of anything they could do, but applying research methods to it. So that's just a little bit about the fundamentals of applied health research module. Excuse me. So the next module, the next compulsory module, would be quantitative methods. So that is taught by Dr. Claire Gillies and Professor Laura Gray. And what you get, and it's a bit like Samuel and I actually, when we work together on our module, when you get more than one module lead, each of the module leads have different sort of expertise. So Laura's is in design and analysis of clinical trials, and Claire particularly does a lot of work around health economics. And I think that's what we try to do when we put these modules together, is ensure that we have people with complementary experience who are teaching on this. So I think, again, this is a lot of how we teach. So it's that middle icon at the very beginning. I think everything is taught by experts in their field, and that is really important to us in this programme. There's loads of practical experience. So in this particular quantitative module, there's lots of use of Stata and data packages, lots of real life data. And so that will be from recently published our own research that here at Leicester and elsewhere. Lots of interactive group work and real focus on discussion. So when I spoke at the beginning about there being lots of people from different backgrounds, doing this programme, I think that's great. The discussion can be really lively because people come from different backgrounds. So in terms of the taught sessions, they will be about research design and also research analysis. So it's from talking about observational studies to randomised control trials, to analysis, looking at regression or systematic reviews and meta-analysis. And of course, your assignments would be on each of these subject areas. So you have to bear in mind that these modules are introductory. I mean, you're not doing a whole course on medical statistics, but it's certainly enough for you to be able to embark on this type of work. So yeah, the way the assignments are put together is that, and this is probably the case with most of our assignments, is one is a heavier assignment of 70% and then a smaller assignment of 30%. But assignment one, I think it's really important what we try to do is give you feedback from the first one before you do the second one. So there's a lot of learning that goes on within that. The final compulsory module would be qualitative methods in applied health research. Now that is taught by Professor Nicola McIntosh, who is a great teacher, who introduces qualitative research methods. The reason I mention here the Sapphire team, which is the Social Science Applied Healthcare and Improvement Research team, is that the teaching staff are absolutely drawn from that team in this qualitative module. And they're a great team of people, again, have a lot of research experience around healthcare improvements. And they will again be using examples of their own research to illustrate the sort of qualitative methodology. So the course overview is very much about qualitative data collection, data analysis. Research communication is also a big part of it as well. So back again to the assignments. The first assignment is critical appraisal of a research paper and also a reflective essay. So once you've done these three core modules, then you have option modules. Now, I'm not going to talk about them in detail, but currently, there are three option modules: measuring and monitoring healthcare, leading, managing and organising quality and safety in healthcare, and science, society and responsible research. Now, I'm not going to give you lots of information about all of them. The last couple of years, a number of students have done science, society and responsible research, and they found it was really quite complementary. So depending on what your particular interest in, but they did find science, society and responsible research quite a useful adjunct to what they were learning in the three core modules. People need to make their decision before they join, but there is a little bit of flexibility once they join. Lastly, I just want to speak about the dissertation. This is critical to talk about the dissertation because it is worth 120 credits. As you probably know, a dissertation is an extended piece of writing focused on answering a specific research question. So it is an opportunity to work independently on something you're passionate about, but it's also the opportunity to learn and to be very well supported in this environment. So the picture on the side is Dr. Sarah Seaton, and she leads on the dissertation module, and she absolutely gives a huge amount of support to our students. So what would happen is a supervisor would be identified, and Sarah Seaton as well would support you. So you would have a supervisor for your research proposal, and you will be helped in the development of your proposal. Some people come in and they've got a brilliant idea and really want to do it, and so it's just a case of refining it. And other people, it takes a little longer for them to decide what it is. But there are three components to your assessment. There is the research proposal, which is just 10% of the mark, obviously the large written dissertation, which is 70%, but actually unusually for us, we do an oral exam, so a viva that is worth 20%, and that is a great opportunity to really talk about your dissertation and share it with examiners who are always really excited to hear your work. So yeah, just to say, so this 120 credits is important. It's quite a long piece of work, but you do not feel isolated because you are continuously supported by your supervisor and by your personal tutor. So of course, in addition to I just wanted to speak really quickly about general student support. We really take our student support seriously on the MRes. You will certainly have a personal tutor, you will have a dissertation supervisor, but you will also have lots of university support available to you, and we can really help you to navigate it. There's also always a student staff committee, so we always have a course rep, and again, that's a great place to have a voice, and we really take the voice very, very seriously. everybody will have a personal tutor. I really enjoy doing personal tutoring, and I think all my colleagues on the programme do. It's a great place to get to know people. We have quite a structured sort of timetable of personal tutor check-ins, you know, seeing how you're getting on, but also talking ultimately about your career and what your aspirations are and what next. So that's quite an important part as well. Yeah, I think I already mentioned that the sort of feedback. This was just from, I just wanted to add this. So we have student staff committees. There was one probably a couple of months ago. And this was just some feedback we got generally about the programme. All of the sessions have been interesting, interactive and thought-provoking. So that's come from our students, and all the module leads have been lovely and very approachable when asked questions. In general, staff are friendly and engaging. So I think, you know, we started at the beginning with what students felt about the programme, and perhaps we're finishing again on what people think about it.